Welcome to the So Why podcast with Step Care Solutions. This podcast aims to explore issues and challenges, as well as ideas and solutions leading to strengthening support for mental wellness and recovery. My name is Alexa Bowl, and I will be your host for this episode. Eating disorders are super common and complicated. We know that early support leads to positive results, but unfortunately, most people don't access care early for a number of reasons. This can include facing internal stigma or downplaying the problem. We know that the health system and mental health system can be under-resourced and hard to navigate, and eating disorders are not something that are often included in regular screenings and prevention campaigns to catch them early. However, the number of people in the emergency room are skyrocketing, and there's a need for solutions. Digital innovations can be one way to facilitate connection and support for folks experiencing eating disorders across the country. An easy-to-reach community of people who can relate and are easy to access as much or as little as needed. Shaleen Jones has been an advocate, organizer, supporter, and all-around rabble-rouser in the field of eating disorders for over 25 years. She has held leadership positions with community organizations like BC Eating Disorders Association, Langhouse, Peer Support Canada, and CMHA National. She is the Executive Director of Eating Disorders Nova Scotia and founder of Body Peace Canada. Having overcome an eating disorder herself, she is passionate about recovery, the transformative power of peer support, and creating sustainable, systemic changes across the sector. Shaleen was one of the first people trained to provide peer support for those with eating disorders in Canada and earned her peer support certification from Peer Support Canada in 2015. Shaleen currently serves on the Mental Health Advisory Council to the Federal Ministry of Health and is a member of the Mental Health Commission of Canada's Hallway Group, Quality Mental Health Care Network, and the E-Mental Health Collaborative. She is a terrible but enthusiastic knitter and devotes time every summer to picking huckleberries to make jam. Let's welcome Shaleen Jones to the So Why podcast. Thanks so much for joining us today on the So Why podcast, Shaleen.
Hi, thanks so much for having me.
So I was wondering if we could start out just learning a little bit about you and what you do and what your background is, just to get to know you a little bit.
Awesome. So my name is Shaleen Jones, and I'm the executive director and founder for a community-based organization based in Nova Scotia, Canada, called Eating Disorders Nova Scotia. I founded the group 25-ish years ago. And we started it because at the time in the province of Nova Scotia, there were very little supports and resources for those who were living with an eating disorder. And I was in my early 20s and had moved here and was looking around for a place to get involved with and to volunteer. And I couldn't find one. And so I started chatting with some like-minded folks and really kind of realized how important being able to connect with others who are going through something similar was, and the transformative power of peer support. And certainly that had played a role for me in my own recovery from an eating disorder. So when I moved to Nova Scotia and looked around and saw there was one and started chatting with folks, they just thought, well, let's start one. How hard can it be? We'll start our own nonprofit to address this huge gap in providing support to folks who are impacted in a non-clinical way. So that's how Eating Disorders Nova Scotia was started. Kind of a gang of young people in their early 20s. And we've grown from there over the last number of years, number of decades. And then just recently, last year or so, we launched Body Peace Canada. We want to have a way to provide peer support for folks who are impacted by eating disorders from across the country. And so we created Body Peace Canada so that Canadians from anywhere in Canada could connect with a trained peer supporter to get some immediate support along that recovery journey.
Awesome. Quite the progression of sort of an idea and a passion to two organizations doing great work through peer support and really filling a gap that is really, really important to fill, especially right now. So really excited to hear about the work that you've done and how it's evolved over the years.
And we really, we started providing peer support, peer support groups back in the early 2000s. And this was kind of before peer support kind of entered into the national consciousness in many ways. It wasn't something that folks were really talking about. But we recognized the value of lived experience and the expertise that folks who had been through something had. And we had a number of volunteers who had been through an eating disorder, and they were also working in the mental health field. They were working as like social workers and therapists and occupational therapists or what have you. We kind of combined the two. And, at the time we thought, oh, well, this is very exciting. We're doing something different. We wanted to create a space where folks could really connect with each other in a way that was really safe and that was going to be effective in helping them share strategies, feel less alone, get connected to other resources, and begin to deepen their own practice around recovery and to strengthen their skills that they had. So we started out providing those peer support groups, like I said, in the early 2000s. So that was like 24 years ago now. And then over time, really listening to folks that we were supporting and trying to think, how can we best meet people where they're at? And what kind of support do people need that may be different, that may not be met by a group? And so we started offering a one-on-one peer support program within that 2012. So over that time, we developed our training program, and I'm so proud of it. It takes place over about 5 weeks, and it's pretty intensive. It has a lot of practicing and skill development and self-reflection, and we really focus on those essential skills you need to provide peer support in a way that's going to be safe and effective and centers the needs of the person that you're supporting. So since that time, like we've had the incredible joy of literally supporting thousands of people in Canada who are in eating disorders recovery and who are recovery curious or just like learning more about what that might look like. And it's been such a joy to get to be a part of people's recovery path.
That's amazing. I love how person-centric it is and how, you're really focused on people's needs and wants and preferences and what works for people versus what doesn't work for people and really building on their strength. Why is it that you are so passionate about eating disorders and why do you think it's such an important topic right now?
I think my passion for this, I'm absolutely, so passionate about this work and so privileged to get to do this job. But it definitely comes back to, my own experience with an eating disorder and the work involved in kind of digging myself out of that and what helped me. And I think that was really kind of the spark. And then being able to be connected to a community of peers who had also been through an eating disorder and were working in that early recovery. So it's my experience and then being connected to peers that really solidified kind of my own, I guess, path forward and being able to to see firsthand how powerful it was to connect with people who understood and who are going through the same thing and were kind of learning together with me. That really impressed upon me like the importance of that low barrier, low intensity support. So certainly reaching out to a medical doctor and being able to advocate for yourself and being able to get referred to treatment, like those are all some really big scary steps. And for many folks, they might not have a family doctor or their family doctor may be less inclined to refer them for treatment. So there's so many barriers for folks who are seeking care. So we try to create programs and support that really meet people where they're at. And we recognize how challenging it is to reach out for help for the first time or how to reach out for help the second or third or fourth time. And so we've tried to create a whole process where people feel really welcomed and validated and encouraged every step of the way. So we try to be kind of like the opposite of gatekeepers. So instead of trying to like keep people from accessing support, we try to like bring people into the fold, into the recovery community as much as we can. Knowing that people go through different phases, and if you're ready one day, you might not be ready the next day. So how can we create a recovery-oriented eating disorder community where folks can feel that sense of validation and non-judgmental support and comfort, and know that we're here to support them every step of the way, and that if they're not ready tomorrow, we'll be here the next day.
That's amazing. I think it's so important to really take people's lead. And it is hard to reach out. It's hard. Sometimes you don't know if you have an issue or not. You don't know, oh, is this serious enough for me to actually talk to somebody about it? Maybe it's nothing. Sometimes, I mean, there's so many emotions and feelings and thoughts that come with reaching out.
Oh,
Um,
100%. Yeah. And I think that's one of the kind of things I'm like so interested in is with folks who are experiencing an eating disorder, quite a large percentage of folks, anywhere from like 60 to 90% never receive specialized support, which is just, it's heartbreaking because we know that with early intervention and rapid access to treatment, people can and do fully recover. But that early intervention is key because the longer the eating disorder grows, the more it becomes entrenched and it becomes very, very difficult to treat and recover from. So trying to really dig into how to smooth that pathway for folks who maybe are concerned. They might have a complicated relationship with food and eating their body, all the way up to folks who are recognizing that they are struggling with an eating disorder, trying to kind of like smooth that path into all the supports that we can offer. So that we can help guide them to more intensive treatment, should that be what they need. We can guide them to our team of clinicians if that's kind of support they're looking for, and really help them navigate that whole mental health care system so that they're able to get access to those higher intensity services.
I like that you're really mindful about the fact that everyone's in a bit of a different place. Not everybody's situation is the same.
Mhm.
And not everybody is in the same sort of level of awareness, even about what an eating disorder is and what, you know, do I fit that criteria or do I
Mhm.
not? Or, so I like how you sort of gear your programming and your peer support toward people to just help them wherever they are at right
Yeah.
now.
Yeah. And we looked into the research and what does the evidence say around what are the barriers for accessing care? And some of them are structural things that need a lot of folks working on them in collaboration to kind of move that needle. But part of it was the illness itself that tells people you're not sick enough, you should be able to handle this on your own, don't tell anyone what's going on. So there's so much secrecy and shame around eating disorders, in the sense that you don't deserve care, you don't deserve help, all that negative self-talk. And one of the features of the Body Peace Canada program is a very short self-assessment, and this is based off of a validated tool from Australia, from the Inside Out Institute. And folks can complete this very short survey, and it lets them know if they're at risk for developing an eating disorder and to what extent. So for folks who don't have an eating disorder, we're like, awesome, great job. We're here if you need us. And then we can provide recommendations and feedback for what steps folks might want to take, depending on their level of risk. So we can really kind of help people feel validated in their struggles and then provide them some really practical next steps, right up to here's a guide to take to your family doctor, and here's how to find a provider in your area.
Those sound like some really helpful tools to help people understand where they're at, to help them understand how to reach out for help, and sort of link them up with some resources that could be helpful if they're interested and if they feel that they need them. You mentioned earlier in the conversation that one of the goals of the peer support and the programming was really to help meet people where they're at so that they know that they're not alone, and you did mention that a lot of people don't reach out for help or they don't have the best experience and they kind of back away when they try to reach out for help. So I wonder what you've learned through doing this that does help people feel comfortable and feel welcome and feel okay with having these conversations and feel safe.
Oh, great question. And I think a lot of this is co-design. So, working with folks, like anything, you want to engage your stakeholders and your target users. And of course, co-design is a great way to do that. And really looking at every piece of the puzzle, every communication that goes out, all the website copy, the response, the reply email you get when you register for programs. Looking at that whole pathway that people will go to from seeing an Instagram ad all the way to attending a program, and how can we craft our messaging and kind of the vibe really so that it's welcoming and non-judgmental and validating and is really clear to people about what's going to happen, what to expect, and how they can access additional support. We also really rigorously evaluate every piece that we do. We're using both like internal measures and tracking, to working with external evaluators and researchers to really learn more about How does each and one of these interventions support people, and how can we adapt it to meet our goals better? So we want to make sure people are engaged, they're getting the supports that they need, they're satisfied with the program, but more so that accessing the peer support programs and the videos and worksheets and the self-assessment and everything else, that those are helping them move forward in their recovery. And we designed our evaluation framework with folks with lived and living experience and our peer mentors and others to look at what are areas that are really important for folks when they're moving forward in recovery. So it's things like self-compassion, quality of life, being able to communicate their needs to others, relationship. So we really don't focus on eating disorder symptoms, but more so around what's important for folks as they move from being actively engaged with an eating disorder into more about being free from an eating disorder.
I really appreciate that you use co-design approach. And I love that you used a co-design approach in evaluating as well to figure out, well, what should we be measuring? What does success even look like for people? Because I think sometimes, when we're professionals or service providers, we get caught in this space where we want to provide the answers and the questions, and we want to measure what we want to measure. But at the same time, maybe what we want to measure is not really what success looks like for somebody living that experience right now.
Yeah, exactly. I think, when we look at the evidence, the literature around what helps people recover from an eating disorder. I mean, there's like many different treatment types and CBT and FBT and CBT and all these other things. But we looked at when people had been through recovery, what were the changes they saw, and what, from that perspective, what was helping them rebuild their lives free from an eating disorder. And it was things like, being more compassionate towards myself, practicing the skills for recovery, like the mindfulness and the self-compassion and the emotional distress, the distress tolerance and these kinds of things. So being able to connect with themselves and being able to connect with the community. So we kind of look at all this great literature that's been generated around recovery. And that really informed how we evaluate our programs and how we design our programs. So like with the peer support group, that may be a drop-in peer support group, we don't expect that taking part in that group is going to necessarily, decrease symptom severity. But we do expect that that's going to increase people's sense of connectivity. It's going to decrease their isolation. It's going to increase their hopefulness for recovery. And these are all things people need in order to make and sustain those behavioral changes. So we like to think that folks can get supported by the range of peer support programs. And then should they need more intensive support, access those while always having that safe landing space of peer support. So as they kind of go through the ups and downs of recovery, they can always dip back in, get some support, rebuild those connections, and then go on to do some of the more challenging work with clinicians if they need to.
You talked a lot about how different people need different things at different times and being on a journey, and everybody's in a different place. And I wonder if you could talk a little bit about the types of services and resources that can be offered along a continuum of care. So, the lower intensity type resources all the way to the more intensive specialized treatment options, and how peer support plays a role along that continuum.
So the supports that are available for folks who are impacted by an eating disorder in Canada, they really range. The supports that we offer through Body Peace Canada and through Eating Disorders Nova Scotia range from some self-directed learning. So we have some self-directed resources like videos and worksheets that cover things like, am I sick enough? Where do I get started in recovery? Some common themes that we've heard from folks who are experiencing eating disorders and kind of in those early days. So folks can learn more. They can watch the videos, they can do the corresponding worksheets, and they can complete their own self-assessment. And that is a 6-item questionnaire that provides them with a customized response about what their level of risk is and what our recommendations are for them going forward. So that's kind of in that self-directed informational learning piece. If folks want to kind of like dip their toe in a bit further, we have free workshops and information sessions that run almost every single week. And these are on a huge range of topics with amazing hosts and facilitators. And they cover things like strategies around managing emotional distress and distress tolerance, all the way up to coping with diet culture and messaging around weight loss. So they cover a huge range. And we have guest speakers coming in who could talk about accessing eating disorders care in different places. So there's a huge range of different types of workshops, information sessions. And so those are all free. They're all virtual. So folks can register and just watch camera off if they want. So it's very low barrier, very easy to access. From there, we have a suite of peer support programs. So this is for folks who are ready to take a bit more of an active role in exploring recovery. Right now, we have 4 drop-in peer support groups. So we recognize that different populations require different things. So we have an all ages drop-in for everyone. And then we have our young adults drop-in peer support group. And this is for folks 17 to 24. So folks who are finishing up high school, they're into university, they're just trying to get into the workforce. We have a special peer support group for them. We also have a group for folks who are 40 plus, and that's been one of our most popular groups. And then we have a group for folks who are trans and non-binary and gender diverse. And then finally, we have a group for folks from BIPOC communities. So really trying to create spaces for folks where they can connect with others who they can really relate to and connect with. Those groups all meet monthly. And again, trying to keep it super low barrier. So how our programming works is you just register for that once, and then you attend whenever you want. We'll just shoot folks a quick email that says, group starts, it's tonight at 6 or whatever the time is. So you don't have to re-register for the program. It just happens smoothly and automatically. So you dip your toe in once, and then we're going to stay connected to you and keep checking in and offering that support. And then for folks who are ready to kind of do a bit more intensive support, we offer our one-on-one peer support program. And that's when we'll actually match someone with one of our trained peer supporters. And we look for folks who have a lot of things in common. So not just kind of what kind of eating disorder symptoms do they have in common, or did they have, but life stage and interests and all different parts of their personality. And our trained peer mentors, we talked about the training earlier. It's 5 weeks, it's fairly intensive. And we work with folks who have at least 2 years experience of recovery under their belt. And that allows them to really draw upon those really rich learnings they had going through that recovery process. So we know that's not a straight line. There's lots of ups and downs, and there's so much learning to be had from that complicated journey through recovery. And so our mentors have at least 2 years experience of being in recovery and managing that. They can really tap into that as they're supporting someone who is newer to that recovery journey. So those are kind of like the arch of our peer support programs, from the self-directed learning all the way to the individual mentoring. Here at Eating Disorders Nova Scotia, we also offer services from clinicians. So we have a dietitians and therapists on our team, so folks can work with them, and those positions those clinicians are subsidized. So we try to remove those barriers as well. And then if folks are outside of the Atlantic region, then we can try to connect them with clinicians in other programs through organizations that we work closely with, as well as with other service providers, sort of east of Montreal, east of Quebec, west of Montreal. Then we can connect them with service providers outside of the Atlantic region.
So that's so interesting that I didn't realize, I think, that peer support was actually embedded at every level. I think I for some reason was thinking that it supported every level, but as you're talking, I'm realizing that's a bit of a misconception, because it seems like the entire continuum is really built on peer support, that even when somebody might be referred to a clinician, they still have that peer support right there to kind of be right there with them as they work through their journey.
Yeah, we kind of think of it as a community of support, and folks can access that community through like a bunch of different pathways. So they can start with working with a clinician, they can start with a group, they can start with a workshop, but all those paths lead to being connected to this larger community of folks, made up of our trained mentor. There's about 55 of them across the country, and other folks who are going through, working through their own recovery pathway too. So it's a really large community of folks who understand and are non-judgmental, and are all kind of rooting for each other.
And who doesn't need community, right?
Yeah.
That's so amazing. So amazing. And I love how a lot of the programs, it's really geared toward how much people want to engage, they can engage. I love the idea of registering once and then you just get an email reminder. And if you are busy that night, no problem. And if you want to skip a couple weeks, no problem. But then when you want to engage, you get that reminder and you're like, you know what? I really want to go to a meeting tonight.
Yeah. And we found like, from listening to people for the past 25 years, and for all of our, almost all of our staff have lived experience, of course, the recovery pathway is complicated and messy and long. And one day you may feel like I'm ready to take on the world and really tackle this. And then the next day, maybe that's not the case. And we didn't want to create supports where if you weren't ready all the time, you couldn't have access. And we've all kind of heard stories of cash-strapped eating disorder programs, or if you miss an appointment or you don't meet a goal, you have to leave the program. And that just didn't resonate with our understanding of how recovery was and how messy that was. So trying to think of how can we create this space that's available for people all of the time, regardless of where they're at. So if they're new to recovery, if they're just exploring it very cautiously, or if they've been up and down for a number of years, if they're post-treatment, like wherever they're at, we want them to feel safe and welcomed, and to know that they're not taking space from somebody else. We have a whole community here to support them, and that we're here every step of the way in whatever way that they need.
So I'm wondering, we could talk a little bit about access and what some ways are that people who might be experiencing an eating disorder or not sure, but are concerned a little bit and notice some stuff going on with themselves, how might they get access to what they need when they need it?
That's a great question. And access to quality mental health care is something that you and I are both very passionate about. So we really recommend that folks start, for folks who are across Canada, they can start at bodypeacecanada.ca. And they can start with the self-assessment or the quiz. And from there, they'll get a recommendation about what programs we think they might want to check out and some other resources that they can use in their life. We may recommend that they talk to their family doctor. In fact, we often recommend that, and we provide them some tools for it. But we're also here to support folks through instant messaging and through text and through email and phone calls too. So if anyone kind of out there listening is thinking maybe their food and eating and exercise is a bit up and down or concerning for them, but they're not sure if they have an eating disorder, then absolutely reach out. Just drop us an email or a message. We can help kind of like navigate through that process. There's some great resources on the website as well they can check out. And it's never really too soon to explore healing your relationship with food and eating. Certainly, as people living in the world today, many of us have complicated relationships with food, eating, and exercise who may not have an eating disorder. But being able to heal that is so rewarding, and to be able to live a life free from having food and numbers and exercise dictate your mood and what you do with your life and risks you take in relationships. I think we all deserve to have that freedom.
Thank you so much for sharing about everything that you're doing, and your organization is doing with eating disorders. I think it's fantastic. I've learned a ton today. Is there anything that we haven't covered that you think it might be important to share? You really wanted to kind of squeeze it in before we close things off?
This morning I was reading a report showing more evidence that restrictive eating really increases your risk for developing an eating disorder substantially. So I think if there's one thing we all kind of take away today, and one kind of thing on our to-do list, I think really challenging some of our notions around what is health, what is wellness, what does fitness look like. Bodies come in all sizes and shapes, just like eye color and hair color and height. We're not all meant to look the same. And if we can work towards freeing ourselves from that, that mindset where how we look is more important than anything else, and stop seeing our bodies as ornaments and more as instruments, and challenging diet culture and creating a world in which eating disorders don't thrive, I think that would create an amazing future for us all.
That's awesome. I totally agree. And such an important thing to remember in the current culture and climate that we're living in. So just so everybody knows, we will put links and all the information in the show notes of the podcast so that you can access everything that Shaleen has been talking about today, and you can learn more about eating disorders and have lots of connections and access if you are somebody that needs support. So thanks so much for joining us today, Shaleen. Hopefully we'll get to talk again soon.
What a great conversation. Thank you.
Thank you once again for joining us on the So Why podcast with Step Care Solutions. For more information on the Step Care 2.0 model, as well as links to resources mentioned in this episode, please check out the show notes below. Thanks for tuning in once again. We look forward to having you back next time.